Once you are in the doctor's office, first of all, you have to get the right gut feeling about the person and understand that for hair restoration, the relationship between the doctor and the patient is generally going to be a long-term relationship. You want to make sure that that doctor is always accessible to you and will be there for you in the long run as you lose more hair, if in fact that occurs. You want a thorough explanation of the procedure. You want to know whether the doctor specializes in hair restoration surgery, how many surgeries he performs.
The tough one to ask physicians very often is, what's your complication rate? Yeah, wow, why would you even ask that question? Well, because any physician who does a large amount of surgery is going to have a few cases that don't go perfectly right. He's going to have complications, and those complications have to be detected early and managed properly. Any physician that's honest will tell you honestly how often he has problems.
Make sure that the doctor describes the whole process to you, what you can do pre-operatively to look after yourself, and also what's going to happen after the procedure, so you can actually plan your life. If you're a person who's working in a hot climate with a hard hat on, you simply cannot go back to work the next day. You've got to take a week off. So you have to have somebody who cares for the whole of you. You might even want to meet the team, because you're dealing not with just a doctor, you're dealing with the whole staff, and you want to make sure that your day is going to be comfortable.
Is the staff knowledgeable? Do you get the same answers from the staff when you ask questions about how the surgery is done as you get from the doctor? Questioning the staff and being alert to the staff and how they respond to you as a patient/customer is a very, very important indicator of how the doctor is going to respond to you as a patient/customer. You want to know who's doing the surgery. Is the physician doing the surgery? Are the technicians doing the surgery? Remember, hair restoration surgery is a team sport. It's not done by just the doctor like a facelift. It requires experienced technicians to assist with managing the tissue and placing the tissue.
You have to be given choices, and then you decide what's best for you. You might decide on a medication, you might decide on surgical treatment, but let you decide, not have somebody, some salesman who bulldozes you into saying, you have to have that number of grafts. Be suspicious, don't go there.
Remember, the consultation is an educational experience for you, an educational opportunity for you, not a sales opportunity for the physician or consultant. And so you need to get information that's specialized about what your personal needs are. There are risk benefits that can be identified with any surgical procedure, and those risk benefits apply to everyone who has the surgery. And then there are risk benefits that are customized depending on your particular medical history, your age, whether you're a smoker, whether or not you have high blood pressure or diabetes, what your family history of hair loss is. All of these kinds of things may change the risk benefit of the procedure for you, and only the physician can give you that information.